Now, taking a look at this comic, I want to tell you the spoiler alert, our U.S. healthcare system is not in good shape. We have a lot of people, a lot of stakeholders involved in it, from the government to the insurance companies. And so we're really going to kind of look at what is the big overview picture here. By the end of this lesson here, I want you to know the basic concepts of the healthcare delivery in the U.S., how it's financed, what are the big challenges that we're going to be discussing over the next few weeks. I'm really excited about this. There's a video in your module called Sickness Around the World by Frontline. It's a little bit out of date, but it's still, trust me, the key players are still the same. They just have different names. You're going to look at US, China, Japan, Britain, and Canada. You need to watch that film. It's really good. And I want you to know the difference between market justice versus social justice. Now, you could download all these PowerPoints and watch this video multiple times. But I'm going to give you just a brief overview of the United States. We have one of the most unique systems of the, and I say unique, in the fact that we, unlike most developed countries, we do not have universal health care. And when I talk about universal health care, it means that everyone has basic rights to the healthcare system. We've done that with education, but we have not done that with healthcare. Now, I'm going to go over different healthcare options in the world, and you're going to kind of dive in to see how we're unique. And in this class over the next 10 weeks, we will be talking about how we got here today, and there's a movement to kind of start moving us more back to a universal approach. So this is a screenshot overall ranking. And one of the big things that kind of blew my mind is I used to think we had, and I say this with very humbly, I used to think we had the best healthcare system in the world. Like, oh, we paid more, but we have the best healthcare. Not the case. So what happens is they've been ranking the quality of care, safe care, coordinated care, patient-centered care. These are all things that are really important for quality of care. Access. And you will find that the United States ranks 11th, but we have the most expensive capita. And now this is 2011. And I want to tell you, every year our health benefits continue to go up. The amount that we're paying goes up. And if you've had to purchase insurance, or if you're covered by your employer, you will find that a lot of times you're paying more and more each year to offset the healthcare cost. And for someone that pays out of pocket, it is cost prohibitive. In fact, we have our cause for bankruptcy in the United States, one of the number one causes is due to medical bills. So in the United States, we are struggling with the healthcare. So here's the thing. In most developed countries, the government plays the central role. And kind of something to keep in mind is that when something affects everybody, the whole entire community, usually the government steps in and regulates that, or controls that, or sets up some kind of system, or sets up a kind of public-private partnership thing. But in the United States, we've pushed it mostly out to the private sector. And when we did that, we've created something kind of which is focused more on market versus social. And I'll be talking about that. I'm going to ask you to watch Sick Around the World, which provides a great overview of all the different healthcare options. So in the United States, how is medical care paid for? Well, we depend on our health insurance through our employer. If you're employed, you might have heard of Blue Cross, Kaiser, MODA here. Charity care, where people have jumped in and paid. Public clinics, so someone can go to a clinic to get communicable diseases, which means infectious diseases, like diseases that get passed on from one person to the next. Community health centers, where people can go in and get a sliding fee. Medicare for those over 65 and with certain medical conditions, not all medical conditions. Basically, kidney failure is the one that they focus in on. So know that that's kind of a trick question in your chapter reviews. So make sure you look at that. Medicaid income criteria. And let me tell you the difference between Medicare and Medicaid. How I remember it is Medicare, you care for those over 65 and with certain medical conditions. Medicaid, you aid people, okay? Then we have something called children's health insurance and veterans assistance. So these are a lot of different ways. So you might notice some of these are public, and then we have private. And so we have managed care, which is private, and really trying to contain the cost. Military, the vulnerable populations, those are the people most at risk. And we have something called long-term care and public health. So that's our healthcare delivery system. This is how we pay for it. This is how we deliver it. Do you see the difference? Pay, deliver. So let's talk about insurance. Okay? And I could see that slide going right underneath the insurance. So if you look at how people pay it, right, which is also how they get it. Does that make sense? So if someone's covered from veterans assistance, then they would be coming in through that. If someone's covered through Medicaid, that they would be going to places that accept Medicaid. If they're covered by Medicare, they're going to places that accept Medicare. Does that make sense? Okay, it's something we're gonna really go through over the next 10 weeks, that how your medical insurance, how your healthcare insurance is paid is really kind of determines where you're going to go. So for those, I love this graphic here. Look at this, employee base. So this is a lot of private insurance here. And it's the employer is paying into it, and a lot of times the employee is paying into it. And then look at this, 29 million still uninsured. And so for the healthcare system, for those uninsured people, they are paying out of pocket. And this is where universal healthcare would pick up those uninsured people. And in our political debates and in the president election coming up, these 29 million people are a lot of people. A lot of people that are working and are trying to make ends meet. And so you could see that this is going to be a very hot issue, because that's a lot of people. So let's talk about now for those people that are in that 156 million employee based. They often get into something called managed care. And those other public entities, Medicaid, Medicare, they can fall into this too. But most of the time it's employer based. So you might have heard something called like Kaiser Permanente. That's an HMO, right? Where you have a primary care physician and then you get referred and then you go to a specialist. Or maybe you're a part of something called a primary, PPO, preferred program, and it's primary care physician. They're your special and they need to be in network. So that's called a PPO, preferred provider organization, and you have to go in network. So both of these are managed care. What they're trying to do is they're trying to control the cost. And what's crazy about all this is that the costs differ from each hospital, from each insurance company, from each region, from each doctor. And if you talk to doctors, they kind of get burnt out because the costs can vary and it can be cost prohibitive for them to be in a PPO. And that's something we're going to be talking about in this class. So realize that this one slide right here, we could dive into it for just one chapter alone. Actually, you could take a whole class on it. And I want you to be familiar, we're going to be going into the terminology of healthcare. So we're going to also be covering that in this class. Like, do you know what a copay is? Do you know what a deductible is? Do you know what coinsurance, out of pocket? That is all following under managed care. And so when you get into a managed care system, you have to be thinking about all these different things. Now, I'm going to blow your mind. In Germany or China or UK or any place where they have universal health care, people don't see any of this. It's just taken care of. So know that this insurance terminology is specific to the United States, and we'll be diving into that in this class. So I talked a little bit about the HMO. This is basically where you have to go inside a health maintenance organization, and what they're doing is they have one person who's like the gatekeeper who controls and moves you through the system, and it's like a Kaiser Permanente where they're really trying to control costs, and it's all in this system. You can't go out of it. So now we move on to another system. It's called the Veterans Affairs, and this is if you're in the military, you're a part of something called TRICARE, and it's free of charge for all those who've been in the service, and so it's very well organized. But there's been times where people have had a hard time getting in, but overall, it's a whole big system that covers our veterans. But then there's also safety nets. For what about those people that are not in the private insured? All right, back up to that slide before where you're looking at different people in different insurance systems. Let's say they're not in Veterans Assistance, they're not in Kaiser Permanente, they're not in PPO. Then they fall into something called the safety net. And this is where Medicare, where those over 65 with end-stage renal disease, kidney disease, or Medicaid for those people who meet income criteria, and are low-income adults, children, and the elderly and disabled. So Medicaid, you have your insurance programs for children, and then you have community health clinics. So these are all the vulnerable populations. They are covered. And so part of that is our community health centers, which are part of that, where they provide programs for migrant farm workers, the homeless, public housing residents, and children. So they receive funding. We have integrated systems where we're constantly looking at reducing the cost, and they work through these community health centers. And you might have heard of community health workers. We're really looking at getting services to those in need. There's also something called long-term care, and this is not covered by Medicare, and those are for those people who fall outside. And this is something where often it's not covered by your private insurance. It can be covered by Medicare in certain conditions, Medicaid, and but it usually falls through the gap, and that's when people need long-term care, and so that a lot of times people need support with this. And then we have public health. Now, public health is just basically keeping us all healthy, and that's a class in itself where we're constantly monitoring the health status of our community and trying to look at problems before they happen. So I want to go back to this market justice versus social justice. And so market justice is basically looking at it as an economic model. And so when you watch that video, Sickness Around the World, know that the United States has really fallen into this area, okay? Private insurance, and that there are 29 million people that are not falling into this. It's where we really look at the private insurance, we look at how much it costs, and we're struggling with that because not everyone fits into this model. And then the social justice model says that pretty much it requires the government to get involved. It assumes that the government gets a lead position, and its ability to pay is not necessary, and access is a right. So I'm going to ask you that when you watch that video, you'll see that China, UK, Switzerland, Japan, Taiwan are all falling into that that blue side, the right side. We fall more into the red side, the left side. So one of the things that we need to start looking at with our U.S. healthcare system is what areas and health policies do we need to start to adapt and start getting access as a right? Because it's not a question anymore if we need to go to the blue. It's how do we start moving towards it, because we do have a problem. I want to say that one of the big things we try to do is this healthcare reform. And we did something called the Affordable Health Care Act. And we're set 27 million people are still uninsured, right? And so the question is, we've tried to, and what you need to know is that a lot of states were going to go into it, but then a big chunk of them stepped out. Over 20 plus of them stepped out. And if you know anything about insurance and economics, and is that you need everybody in to help reduce the cost. So when states stepped out, it really kind of put a gap in our ability to do it. Okay? So we still have imperfect market conditions. We're not able to really get our costs down. So if you look at this, and I want to show you this slide in detail. If we look at this slide from current slide right now, you'll see that our healthcare costs continue to go up. So every year they're going up. Our expenditures are going up, and even for those who are covered by their employer, or they fit in Medicaid or Medicare, it's putting a strain on our healthcare system. So for the hospitals, the doctors, the insurances, they're struggling because they're trying to make things work, and we're struggling as a system. So in conclusion, we have a lot to discuss over the next 10 weeks. We are struggling with our patchwork systems, and no country has the perfect system. You're going to see that when you watch the sickness around the world, that a lot of people are, and different countries are each struggling with healthcare. So there's no perfect system, but you'll see that countries overall and other areas have a more comprehensive system than the United States, and they are making gains with this. So you'll see with Taiwan, they have a great system, but you'll see that they're struggling with healthcare cost.